Good afternoon. This is Doug Farquhar. I direct government affairs for the National Environmental Health Association. This afternoon, we are going to have a webinar discussing the Environmental Health Workforce Act. The environmental health profession has seen a significant decrease in workforce capacity since 2008. The state health agencies and the local health department workforce, which environmental health is the second largest sector, have been subject to recent challenges affecting recruitment and retention of staff. The Environmental Health Workforce Act, which is House HR 2661, seeks to address these problems. The Act seeks to set model standards and guidelines for credentialing environmental health workers, establish an environmental health workforce development plan, create a report to Congress on the best practices regarding environmental health credentialing by studying the practices in 6 states, and provide loan forgiveness for environmental health workers who are accredited, certified, and licensed under applicable law. Our speakers today are the Honorable Congresswoman Brenda Lawrence and NEHA Executive Director Dyjack. Representative Brenda Lawrence is from Michigan, and she is the sponsor of the Environmental Health Workforce Act. The Michigan 14th District includes portions of Detroit, City of Southfield, and 16 other cities located in Oakland and Wayne County. Living in the 14th District her entire life, she was first elected to the U.S. House of Representatives in November 2014, after previously serving as mayor of Southfield. Born and raised in Detroit, Congresswoman Lawrence earned her bachelor's degree in public administration from Central Michigan University. And before she began her career in public service, the Congresswoman had a notable career as a U.S. postal worker. With that, I'm going to say, first of all, thank you for sponsoring the Environmental Health Workforce Act. And with that, I'm going to turn it over to the Congressman.
Good afternoon. Thank you all so much for allowing me to speak today. And I just want to thank the National Environmental Health Association for everything that you do. I'm excited to talk about something that we collectively both agree on. And that's why I was so excited to introduce the Environmental Health Workforce Act. We know that public health crises like the Flint water crisis, COVID-19, and the flooding that we have seen in these recent 1,000-year rains that seem to happen every month. Public health crises are underscored by the critical role that our environmental health workforce plays in keeping our community safe and keeping it healthy. It's everything from food safety to air quality and soil health and safe water. Here in Michigan, we know all too well about the struggles with unsafe drinking water. And now another city in Michigan, Benton Harbor, was recently advised to use plastic drinking water from a plastic bottle due to possible lead contamination. Ladies and gentlemen, it's just becoming more and more pronounced, the real need that we have to step up and provide some leadership when it comes to environmental survival, I'm calling it. In Detroit, about 15,000 children under the age of 6, 15,000 test positive for elevated lead every year. And of those tested, about 7% are diagnosed with lead poisoning. It's unacceptable that in these United States of America, children are getting sick and poisoned from their own drinking water. We must do better. You know, we're talking about this investment in our infrastructure, which we so desperately need. We know that our bridges and our roads, they're crumbling in front of us. But I will tell everyone listening to me, a pothole is an inconvenience, but water, safe, clean, and affordable drinking water is essential to life. And we must take every step that we can to address this environmental crisis. And we can do that collectively by strengthening and supporting our environmental health workforce. In 2008, more than 50,000 state and local environmental health workforce jobs have been lost. And according to the CDC, up to 50% of the environmental health workforce will be eligible to retire in the next 5 years. We have a real crisis on our hands. And that's why passing the Environmental Health Workforce Act is so important. I thank you, Doug, for highlighting some of the key components of it. But what we need to do is set standards for credentialing our environmental health care workers. Now, health workers. Many of us know that as we look at our workforce and trying to figure it out, protecting our environment must not be an afterthought. It should be credentialed, certified people working in that area. And we need a comprehensive plan to develop our workforce. And we need to report on best practices and make credentialed environmental health workers eligible for public service loan forgiveness. As we talk about student debt, as we talk about our workforce and people not working and all the challenges, think about if we offer jobs in the environmental health arena and offer public service loan forgiveness. Isn't that an attraction for an area that is fulfilling, because many of you have chosen it? And I'm proud to say that the bill is endorsed by the National Environmental Health Association, the Association of Environmental Health Academic Programs, and more. Recovery from any public health crisis won't be possible without our environmental health workers. Our country needs them. It's not something that is optional. It's nice if they're there. We need them. And that's why we need to pass this bill to strengthen this workforce, which is life-saving in America. The safety and health of America depend on it. I thank you so much for bringing people together for this webinar, and I will take any questions if you would like.
If anybody has a question for the Congresswoman, if you could just type it into the chat, we can at least be able to take you have a few moments to share with us, don't you?
Yes, I do.
That'd be great. A couple have popped in just to bring over, but the first question is, this would provide loan forgiveness for the environmental health workforce for both the state and local environmental health workforce. Is that correct?
What we're looking at, I write legislation for the federal government, and I would say anyone who is in the position of the environmental health workforce on a federal level would receive that. Hopefully we can pass this on down to our state environmental jobs as well, but that would be a state decision. This bill would take care of those in the federal work sector.
Excellent. We do have a question here. How does the bill look in terms of other Congress people who have signed on as co-sponsors?
We have received, and I'm sorry I don't have the exact number in front of me, but we have received a number of co-sponsors. You helped so much when you lobbied on the Hill, and we've been restricted because of COVID, but prior to that, of working and getting co-signers supporting us. But we're going to do a full court press, and we know that it's in committee, and we're going to work to get it out committee so that we can get it to the floor for the vote. But we do have a number of, at least I know, almost 100 signatures already.
With this, there's also some discuss here about climate change core that President Biden is pushing.
Mm-hmm.
Do you know if it's going to have an impact with that? Would that group be included, or would that be separate?
What I'm finding is a lot of issues that are coming out of the White House are policies. But when we really want to enact and ensure something is solidified and it's going to happen, we need to pass laws and bills. And that's why the thing that to me, I want everyone to pay attention to is that we are saying develop a comprehensive plan to develop the workforce. Instead of just saying we need to recruit more people and create awareness, we're saying what's the plan? And also to report on the best practices. So in some parts of the country, they may be doing a better job than others. Let's grab that and make that the national standard. So those are things that are not in President Biden's initiative, which I totally support. But this is things to make it law, and also to incorporate the loan forgiveness is something that I think should, I know should be part of law.
Well, and we have many, many other questions, which I'm going to hold off because I think we could spend the whole afternoon with you. You're fascinating, and we all appreciate the work you're doing. But at this point, I would like to introduce Dave Dyjack. Dr. David Dyjack is a PhD. He's a certified industrial hygienist, and he's also the Executive Director and Chief Executive Officer of National Environmental Health Association. Dr. Dyjack has been involved with environmental health for the past 30 years and is a board certified hygienist with advanced degrees in public health from the University of Michigan and a master's degree from the University of Utah. So with that, I'd like to turn it over to Dr. Dyjack.
Thank you, Doug. And Representative Lawrence, it's an honor to be on the same platform, digital platform with you. I do want to convey that the audience remains electrified from your 2017 keynote in Grand Rapids to our constituents, and we appreciate that. I do want to, before I begin my formal comments, suggest or share some of the insight in the questions that, and by the way, I think you have like 20 questions, so you're very popular. I never get that many, so I'm kind of jealous. But our colleagues in Guam and some of our local colleagues who work in environmental health at the local level, they are asking, please don't forget about us in the territories, don't forget about us at the local level, because environmental health is profoundly local. I know in your experience as a councilwoman and a mayor, because you shared those stories in Grand Rapids, just how important localness is. All of us go home at night, and we live in local communities. We go to local places of worship, local schools, local restaurants. And so the localness is, I think, a theme. And this is where many of our constituents work and practice, is at the local level. I would just like to share just a few thoughts as we move forward. You know, a slogan from the U.S. Centers for Disease Control, National Center for Environmental Health, says that environmental health is for everyone, everywhere, all the time. And I think that there's truth to that. And I'm reminded not only of the important issues that you've identified, Congresswoman Lawrence, about lead and water and soil and air and food, but the environmental health workforce is the public health workforce in many parts of the country. And for many of us, both within public health and outside, don't understand that. And I'd like to share just a quick story with you, if I may. At that conference in Grand Rapids, regretfully, we had an important speaker withdraw at the last moment. And I was left with a hole in our agenda. And because it was 2017 and the opioid epidemic was front page news at that time, I felt it was important to bring in a local expert from the Grand Rapids area to fill in at the last minute. And Congresswoman, I was actually criticized for that. It's like, this is an environmental health conference. Why are you inviting somebody who's involved in opioids to speak? So I felt pretty roundly criticized. And when the moment for that session came, And by the way, it was added at the last minute. I wasn't even sure anybody saw a change to the agenda. Congresswoman, I was shocked when I opened the door to the meeting room. It sat about 75 people and virtually every chair was taken. And all along the walls, people were standing. I know you've been in those environments where the issue was so important. And I took executive director's prerogative and I asked, why are you here? This is an environmental health conference. And the response I got, Congresswoman, was we are public health in our communities, particularly in rural and frontier locations of the United States. Most of the workforce is environmental health. You heard Doug mention earlier, the second largest part of the public health workforce is environmental health. And I was regaled with stories by environmental health professionals on how they were involved in needle exchange programs. Imagine that. And they were involved in drug take-back programs. And they were involved in other issues related to opioids simply because they were the workforce. There was nobody else to call. And to be honest with you, we are seeing the same thing in COVID as we now speak. I firmly am supportive of all the kudos every single clinician has received over the last 18 months. Make no mistake, they deserve. My daughter's a nurse. She worked on the floor until just recently. Those people really dedicated their lives and risked their lives in many cases to support patients with COVID. But if you take a step back and look at the public health interventions at the local level, environmental health professionals have been profoundly involved in those. As we think about reopening the economy, in many places it is reopened. Think about taking a flight from Detroit to Washington, D.C. National. Somebody has to make sure that the filtration systems and the sanitation and hygiene on those planes is suitable. How about your local restaurant? How do you place patrons? What kind of air filtration systems should there be? Is your local school safe to have students go back? How about playgrounds? How about pools and spas? How about your local place of worship? And it is environmental health professionals working largely in an invisible fashion behind the scenes that are helping escort society into the future. And I don't want to lose this opportunity to applaud them. And I know that you've applauded them on many occasions, and we are profoundly grateful for that support. But when the administration and others talk about, well, public health, who are they talking about? Honestly, in many cases, they're talking about the environmental health profession. And I don't want us to lose sight of that as we move into the future, because public health issues are going to be front and center from this day forward. This is what I know right now. In your home state of Michigan, Congresswoman, on June the 25th, I don't know if you were in the state at that time, there was a deluge, there was a heavy rain. And do you know that 10 billion gallons with a B, I mean, it's shocking, 10 billion gallons of untreated sewage water was discharged to your surface waters in your state. This is an extreme weather event. You talked about 1,000-year floods happening every year. Well, you had one this summer, as you know. And who is out in the streams and the rivers and the surface waters, making sure that for families that may want to recreate in those places or have access to them? It's the environmental health workforce that's out there on the front lines, ensuring that youngsters like me, when I was a kid, I used to visit local streams to catch frogs and tadpoles. It is the environmental health workforce that's really leading the charge on that. Wildfires in the West. Environmental health professionals are not primary responders, but when the fire goes out, the next question is, when can I go home? Is it safe for me to go home? Is my well water safe to drink? And it's environmental health professionals that are involved in that. The big heat dome in Seattle, King County last summer was a really important case study because local supermarkets were unable to keep their dairy and produce suitably chilled. So there was an enormous amount of waste and trash that was created because those consumer products had to be thrown away, and it was environmental health professionals that were involved in that. So I could go on and on, but this profession is central to the health, safety, and I'd like to add the economic security of your community, of my community, and communities everywhere. When we think about retail food safety, I was interviewed by the Washington Post and the Wall Street Journal for the Chipotle norovirus outbreak. They lost almost $1 billion in business because of a retail food issue. And so the centrality of the profession, not putting people out of business, but supporting them so that they can conduct their work in a suitable and safe way, I think is something that we certainly want to call out, because we want to protect jobs. We want to protect industry. And our profession spends its time in the field, not inside of offices, but in the field. And so we know local culture, we know local languages, we know where the risks are because our constituents are out there. I think as I close, the future, I hope is bright. I pray is bright. And we're doing everything we can to ensure that every resident, every citizen, every American can live a long, full, productive life, that environmental justice is addressed, that spillover of diseases from animals to human is addressed. Cannabis is becoming legal, both recreational and medical throughout the country. It's environmental health that is working on that. Diseases like Chagas and Lyme and Zika, and tire crumbs in playgrounds all around the country. I could go on, but I don't want to bore you or to bore our audience, but we appreciate your leadership and applaud the Environmental Health Workforce Act, HR 2661. And with that, Doug, I will turn it back over to you.
Dr. Dyjack, thank you very much for those comments. And also, Congresswoman Lawrence, thank you very much for being with us this afternoon. Both your schedules are incredibly busy, but being able to be with us, I greatly appreciate that. Many of these questions that were going in, and to let both the panelists know, there's an enormous amount of questions. There are many, many questions. I'm going to try my best to handle those and respond to them, and which ones I cannot, I'm going to reach out to Representative Lawrence's office and see if we can get answers for them to make sure everybody gets their questions answered. With that, I'm just going to close by saying, once again, thank you to Representative Lawrence, and thank you to Dr. Dyjack for being with us this afternoon. The Environmental Health Workforce Act is very important, and NEHA is collecting names of people who would like to support the act that we can share with the Congresswoman and her efforts to get the law passed. With that, I'm going to say thank you to everyone for joining us this afternoon. Thank you to our panelists, and thank you to the members of NEHA who are with us today. With that, have a great afternoon.
Thank you.